Hi, my name is Joseph Hunter. I'm the Suicide Prevention Coordinator at the Stratton VA Medical Center in Albany, New York. I'm also a VA Hartford Scholar in the Cohort 12 of the VA Hartford Social Work Faculty Scholars Program. I'm very grateful to the John A. Hartford Foundation and to the Geriatric Social Work Initiative and Barbara Berkman and all the people who have worked so hard to help these social work scholars do their research and be successful, which has presented many challenges at the VA, and they've hung in there with me, so I'm very grateful for that. As I mentioned, I'm the Suicide Prevention Coordinator at the VA in Albany. I did my undergraduate work at Lemoyne College, which is in Syracuse, New York. In 1993, I earned my MSW, and then in 2010, I earned a PhD in social welfare, both at the University at Albany, State University of New York. I'm also a New York State licensed clinical social worker and an internationally certified alcohol and drug counselor. I've been in the field, if you did the math, about 19 years now. And I've worked in outpatient, inpatient, and residential levels of care. I have experience in county, state, and federal settings, as well as for-profit, not-for-profit settings. I've held a wide variety of roles in my career thus far, including a counselor and therapist, addiction program specialist, team leader, care manager, quality management specialist, program coordinator, and researcher. To date, my research has focused on spirituality practices in adult outpatient chemical dependency treatment programs, adolescent chemical dependency best practices in treatment, and intervention research addressing suicide risk for older veterans. I also have developed a theory in the area of social work practice entitled self-preservation theory, which ties in nicely to the intervention work that I am doing and relates to my Hartford Scholars research. My mentor in the Hartford Scholars program is Zvi Gellis, and I'm very grateful to Zvi for the support and patience and direction that he has given me over the course of preparing to get my research launched. The research that I'm conducting is a randomized controlled trial of a inpatient psychiatry intervention focused on suicide prevention. Specifically, we're targeting veterans age 50 and older who have thoughts of suicide at the time of admission. The goals of the intervention, of course, are to reduce suicidal ideation, increase hopelessness, increase connection to people of support and who are helpful in care for the veteran, to improve subjective well-being, and generally improve quality of life for the veterans at risk for suicide. The intervention is focused specifically on building meaning and purpose in life experiences, and so the intervention focuses on those strengths and interests that can reinvigorate the veteran's passion for life, so to speak. The research, as I mentioned, is a randomized controlled trial. The sample I'm shooting for is 80, and I'm using a non-restricted randomization strategy for that. The analyses, I'm going to use several different analyses, including random effects modeling, the Cox proportional hazard model, and structural equation modeling. I'm hoping that this line of research will prove productive, and the next step would then be move on to an implementation study within the VA system where we're testing the intervention in a similar manner at multiple sites. So that is my Hartford Scholars Research Project, and as I said, I'm very happy to be here, and I welcome you as new scholars to the Hartford Scholars Program. I'm sure you'll find it as enriching and as fulfilling as I have thus far.